Phlebotomy Result Review. Question 1. A serum separator tube, SST, contains an additive that assists in what process? Option A. Preventing coagulation. Option B. Accelerating coagulation. Option C. Inhibiting glycolysis. Option D. Preserving blood cultures. The correct answer is option B. Accelerating coagulation. Serum separator tubes contain a clot activator that speeds the formation of a clot before centrifugation. After clotting, the gel barrier separates serum from blood cells during spinning. Anticoagulants prevent clotting, so they would not produce serum in the same way. Question 2. What condition can occur if blood is drawn from an arm on the same side as a recent radical mastectomy? Option A. Syncope. Option B. Lymphedema and altered test results. Option C. Petechiae. Option D. Sclerosed veins. The correct answer is option B. Lymphedema and altered test results. The arm on the side of a recent radical mastectomy may have impaired lymph drainage and increased risk for swelling. Blood collection there can worsen lymphedema and may also produce altered results from compromised circulation. The unaffected arm or an approved alternate site should be used whenever possible. Question 3. What is the maximum acceptable delay time for separating serum or plasma from cells for most routine chemistry tests? Option A. 30 minutes. Option B. 2 hours. Option C. 4 hours. Option D. 8 hours. The correct answer is option B. 2 hours. For many routine chemistry tests, serum or plasma should be separated from cells within about 2 hours. Delayed separation allows cells to consume glucose and release or exchange analytes. Excessive delay can produce inaccurate results even if the collection itself was successful. Question 4. Which of the following tubes contains the anticoagulant lithium heparin? Option A. Light green top, PSD. Option B. Dark blue top. Option C. Yellow top. Option D. Gray top. The correct answer is option A. Light green top, PSD. Light green plasma separator tubes commonly contain lithium heparin and a gel barrier for chemistry testing. Heparin prevents clotting so plasma can be separated quickly after centrifugation. Other tube colors are used for trace metals, cultures, glucose preservation, or coagulation testing. Question 5. If a patient is receiving an intravenous 4 infusion in the right arm, where should the phlebotomist attempt to draw blood? Option A. Directly from the foreline itself. Option B. From the left arm. Option C. Above the foresite on the right arm. Option D. From the hand on the right arm. The correct answer is option B. From the left arm. Drawing from the opposite arm avoids dilution or contamination from the fore-infusion. For fluids, medications, and additives can alter test results if sampled from the same side. Drawing directly from the line or above the infusion site requires special authorization and is not routine phlebotomy practice. Question 6. What is the most appropriate step to ensure compliance with quality control measures regarding point-of-care testing? POCT instruments. Option A. Calibrating the machine once every year. Option B. Running control solutions at scheduled intervals according to facility protocol. Option C. Cleaning the display screen with water after every patient test. Option D. Trusting the automated self-check system without external verification. The correct answer is option B. Running control solutions at scheduled intervals according to facility protocol. Point-of-care testing requires routine quality control to confirm the instrument and reagents are performing properly. Running controls according to manufacturer and facility schedules helps detect problems before patient results are reported. Relying only on automated self-checks or annual calibration is not sufficient. Question 7. Which organization regulates safety conditions in the workplace, including exposure to blood-borne pathogens? Option A. CDC. Option B. FDA. Option C. OSHA. Option D. CLSI. The correct answer is option C. OSHA. OSHA sets and enforces workplace safety requirements, including rules for blood-borne pathogen exposure. These standards address training, protective equipment, sharp safety, and exposure control plans. CDC and CLSI provide guidance, but OSHA is the regulatory enforcement agency for workplace safety. Question 8. What type of legal charge can be filed if a phlebotomist discloses a patient's private medical details to a neighbor? Option A, assault. Option B, battery. Option C, invasion of privacy or breach of confidentiality. Option D, negligence. The correct answer is option C, invasion of privacy or breach of confidentiality. Sharing a patient's private medical details with a neighbor is a breach of confidentiality and invasion of privacy. Health information may be disclosed only for authorized treatment, payment, operations, or with proper permission. Assault and battery involve threats or touching rather than privacy violations. Question 9. Which of the following conditions can cause a specimen to appear cloudy, milky, or white after centrifugation? Option A, extensive hemolysis from using a small gauge needle. Option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Option C, icterus caused by elevated levels of circulating bilirubin molecules. Option D, failure to invert an additive tube immediately after collection. The correct answer is option B, lipemia caused by high concentrations of lipids or fats in the blood sample. Lipemia causes serum or plasma to appear cloudy, milky, or white because of high lipid concentration. It may result from non-fasting status or lipid metabolism disorders. Hemolysis and icterus cause red or yellow discoloration rather than milky turbidity. Question 10. Which of the following procedures requires a strict chain of custody documentation form to accompany the sample? Option A, routine cholesterol screen. Option B, workplace drug testing. Option C, blood culture for endocarditis. Option D, complete blood count for anemia. The correct answer is option B, workplace drug testing. Workplace drug testing requires chain of custody documentation because results may have legal or employment consequences. The form tracks the specimen from collection through analysis and reporting. Routine cholesterol, CBC, or culture specimens do not usually require forensic level tracking. Question 11. What is the primary purpose of the laboratory's safety data sheets, SDS? Option A, to track the daily attendance and performance records of employees. Option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Option C, to schedule the preventative maintenance routines for centrifuge machines. Option D, to log the critical panic values reported to physicians. The correct answer is option B, to provide detailed information regarding chemical hazards, handling, and first aid measures. Safety data sheets provide essential information about chemical hazards, safe handling, storage, spill response, and first aid. They support employee safety and emergency response in the laboratory. They do not track attendance, equipment schedules, or critical value reporting. Question 12. What clinical term describes a systemic infection caused by pathogenic microorganisms or their toxins circulating in the bloodstream? Option A, hematoma. Option B, sclerosis. Option C, septicemia. Option D, petechiae. The correct answer is option C, septicemia. Septicemia is a systemic bloodstream infection caused by pathogenic microorganisms or their toxins. It is clinically serious because organisms and inflammatory mediators circulate throughout the body. Hematoma, sclerosis, and petechiae describe local bleeding or vessel conditions rather than systemic infection. Question 13. Which of the following infections is considered the most common nosocomial risk for healthcare workers handling blood? Option A, human immunodeficiency virus, HIV. Option B, hepatitis B virus, HBV. Option C, tuberculosis, TB. Option D, malaria. The correct answer is option B, hepatitis B virus, HBV. Hepatitis B has historically been a major occupational concern for workers exposed to blood because it is efficiently transmitted by percutaneous injury. Vaccination reduces risk, but exposure prevention remains essential. HIV, tuberculosis, and malaria require appropriate precautions, yet they are not the most common blood-handling nosocomial risk in this context. Question 14. What is the function of the thixotropic gel inside an SST or PSD tube? Option A. To accelerate the coagulation cascade. Option B. To form a physical barrier between cells and serum/plasma during centrifugation. Option C. To preserve glucose levels for up to 24 hours. Option D. To chelate calcium and prevent fibrin formation. The correct answer is option B. To form a physical barrier between cells and serum/plasma during centrifugation. Thixotropic gel moves during centrifugation to create a stable barrier between the cells and the serum or plasma. This separation limits ongoing cellular metabolism and analyte exchange after spinning. The gel does not act as the anticoagulant or the clot activator. Question 15. What should a phlebotomist do if they observe a hematoma forming rapidly under the skin surface while performing a venipuncture? Option A. Adjust the needle angle to try to drain the hematoma into the collection tube. Option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. Option C. Instruct the patient to pump their fist forcefully to redistribute the blood. Option D. Advance the needle deeper to pass completely through the hematoma layers. The correct answer is option B. Terminate the draw immediately, release the tourniquet, withdraw the needle, and apply firm, direct pressure to the puncture site. A rapidly forming hematoma means blood is escaping from the vessel into surrounding tissue. The draw should be stopped, the tourniquet released, the needle removed, and firm pressure applied. Continuing the attempt can enlarge the hematoma and increase pain or bruising. Question 16. What is the primary reason for avoiding venipuncture on an arm with an active hematoma? Option A. The needle will cause the hematoma to spread to the opposite arm. Option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. Option C. The vacuum tubes will implode due to tissue density variations. Option D. It will cause immediate and permanent paralysis of the limb. The correct answer is option B. The sample will be contaminated with hemolyzed, stagnant blood from outside the vein. A hematoma contains pooled blood outside the vein that may be stagnant or hemolyzed. Drawing through or near it can contaminate the sample and worsen tissue injury. A different site, preferably the opposite arm, should be selected when possible. Question 17. Which of the following tests requires that the specimen be transported to the laboratory on an ice slurry immediately after collection? Option A. Lactic acid and ammonia. Option B. Cold agglutinins and cryoglobulins. Option C. Bilirubin and vitamin B6. Option D. Prothrombin. Patient. The correct answer is option A. Lactic acid and ammonia. Lactic acid and ammonia specimens are commonly transported on an ice slurry to slow cellular metabolism and chemical change. Rapid chilling helps preserve the concentration present at collection. Warm transport or light protection is required for different special tests. Question 18. What type of fluid is obtained during a lumbar puncture procedure? Option A. Pleural fluid. Option B. Synovial fluid. Option C. Cerebrospinal fluid, CSF. Option D. Peritoneal fluid. The correct answer is option C. Cerebrospinal fluid, CSF. A lumbar puncture obtains cerebrospinal fluid from the subarachnoid space. CSF surrounds the brain and spinal cord and is tested for infection, bleeding, malignancy, and other neurologic conditions. Pleural, synovial, and peritoneal fluids come from different body cavities. Question 19. When performing venipuncture, the needle should be inserted with the bevel facing in which direction? Option A. Facing downward. Option B. Facing upward. Option C. Facing to the left. Option D. Facing to the right. The correct answer is option B. Facing upward. The bevel should face upward so the sharpest edge enters the skin and vein smoothly. This orientation reduces tissue trauma and improves the likelihood of entering the venous lumen. Turning the bevel down or sideways can make insertion more painful and less controlled. Question 20. A patient under contact precautions requires a blood draw. Which of the following personal protective equipment, PPE, must the phlebotomist don before entering the room? Option A. N95 respirator and gloves. Option B. Gown and gloves. Option C, surgical mask and face shield. Option D, gown, mask, and goggles. The correct answer is option B, gown and gloves. Contact precautions require barrier protection against organisms spread by direct touch or contaminated surfaces. Gown and gloves protect clothing and hands before entering the room and should be removed according to facility procedure before exit. Respirators are reserved for airborne hazards, while masks and eye protection are added when splash or droplet exposure is expected. Question 21. Which of the following situations can cause a false elevation in a patient's serum ammonia level? Option A, transporting the specimen to the laboratory on ice. Option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Option C, using a green top tube containing sodium heparin. Option D, labeling the specimen tube at the patient's bedside. The correct answer is option B, delaying the separation of cells from the plasma beyond 15 minutes at room temperature. Ammonia can rise falsely when cells remain in contact with plasma at room temperature. Prompt chilling, rapid transport, and timely separation help preserve the true value. Delays beyond recommended handling times are a major pre-analytical source of error. Question 22. If a phlebotomist notes that a patient has an active hematoma in the right antecubital area, where should they draw blood? Option A, distal to, below, the hematoma in the right arm, or use the left arm. Option B, directly through the center of the active hematoma swelling. Option C, proximal to, above, the hematoma on the upper right arm. Option D, from the foot on the same side as the hematoma. The correct answer is option A, distal to, below, the hematoma in the right arm, or use the left arm. An active hematoma contains pooled blood outside the vessel and should not be punctured. The opposite arm is preferred, or a site distal to the hematoma may be used if appropriate and permitted. Drawing through the swelling can contaminate the sample and worsen bruising. Question 23. Which of the following values represents a normal fasting blood glucose level for a healthy adult? Option A, 70 to 99 mg/dl. Option B, 140 to 180 mg/dl. Option C, 200 to 250 mg/dl. Option D, 300 to 350 mg/dl. The correct answer is option A, 70 to 99 mg/dl. A normal fasting glucose for a healthy adult is generally about 70 to 99 mg/dl. Values above that range may suggest impaired fasting glucose or diabetes depending on diagnostic criteria and repeat testing. The higher ranges listed would be abnormal and require clinical follow-up. Question 24. What is the clinical name for the stoppage of bleeding from a damaged blood vessel? Option A, hemostasis. Option B, homeostasis. Option C, hemolysis. Option D, hemoconcentration. The correct answer is option A, hemostasis. Hemostasis is the process that stops bleeding after vessel injury. It involves vascular constriction, platelet plug formation, and coagulation. Homeostasis is broader internal balance, while hemolysis and hemoconcentration are specimen or blood changes. Question 25. How many times should a light blue top tube be inverted immediately after collection? Option A, 1 to 2 times. Option B, 3 to 4 times. Option C, 5 to 8 times. Option D, 10 to 12 times. The correct answer is option B, 3 to 4 times. Light blue citrate tubes should be gently inverted 3 to 4 times after filling. This distributes the anticoagulant without damaging cells or activating clotting. Too few inversions can allow clot formation, while vigorous shaking can cause hemolysis. Question 26. When collecting a blood alcohol level for legal purposes, what antiseptic should be used to cleanse the site? Option A, 70% isopropyl alcohol. Option B, tincture of iodine. Option C, chlorhexidine gluconate or soap and water. Option D, hydrogen peroxide. The correct answer is option C, chlorhexidine gluconate or soap and water. Alcohol-based skin cleansers are avoided for legal blood alcohol collections because they can raise questions about contamination. Chlorhexidine, povidone iodine, or soap and water are acceptable non-alcohol alternatives depending on policy. Routine alcohol prep pads are appropriate for many venipunctures but not for forensic alcohol testing. Question 27. What type of consent is assumed when an emergency department patient is unconscious and requires immediate life-saving laboratory work? Option A, expressed consent. Option B, informed consent. Option C, implied consent. Option D, verbal consent. The correct answer is option C, implied consent. Emergency implied consent applies when an unconscious patient needs immediate life-saving care and cannot provide permission. Necessary laboratory work may proceed under facility policy to support urgent treatment. This differs from routine outpatient cooperation or signed informed consent. Question 28. What is the primary purpose of the Joint Commission's National Patient Safety Goals, NPSG, in phlebotomy? Option A, to reduce the cost of laboratory testing instruments. Option B, to improve the accuracy of patient identification and eliminate diagnostic errors. Option C, to mandate the exact number of draws a phlebotomist must perform per hour. Option D, to regulate the salaries of medical laboratory technicians. The correct answer is option B, to improve the accuracy of patient identification and eliminate diagnostic errors. The National Patient Safety Goals emphasize accurate patient identification to reduce diagnostic and treatment errors. In phlebotomy, this directly affects bedside identification, specimen labeling, and matching the order to the patient. The goals are not designed to set draw quotas or regulate laboratory salaries. Question 29. Which of the following statements is true regarding standard precautions in healthcare settings? Option A, they apply only to patients with known, documented infectious diseases. Option B, they mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Option C, they require healthcare workers to wear a full gown and face shield for every routine venipuncture. Option D, they permit the recapping of used needles as long as you use 2 hands. The correct answer is option B. They mandate that blood and all body fluids must be treated as potentially infectious regardless of the patient's perceived status. Standard precautions require treating all blood and body fluids as potentially infectious. This approach protects healthcare workers and patients regardless of diagnosis or appearance. Selective precautions based on perceived risk misinfections that are unknown or asymptomatic. Question 30. What should a phlebotomist do if an inpatient's door is closed and a sign states no visitors, see nurse before entering? Option A, knock loudly, open the door, and walk right in to maintain efficiency. Option B, locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Option C, skip the patient and come back at the end of the shift without checking in. Option D, call the patient's room phone from the hallway to ask if it is okay to enter. The correct answer is option B. Locate the nurse assigned to the patient to find out the specific isolation or safety entry protocols. Assign directing staff to see the nurse may indicate isolation, safety, behavioral, or procedure restrictions. The phlebotomist should check with the assigned nurse before entering. Entering without clarification can endanger the patient, staff, or specimen collection process. Question 31. Which gauge needle has the smallest lumen diameter? Option A, 18 gauge. Option B, 21 gauge. Option C, 23 gauge. Option D, 25 gauge. The correct answer is option D, 25 gauge. Needle gauge is inversely related to lumen size, so higher gauge numbers have smaller openings. A 25 gauge needle has the narrowest lumen among the listed sizes. Smaller lumens can increase hemolysis risk when used for routine venipuncture. Question 32. Chain of custody protocols are required for which type of laboratory specimens? Option A, routine lipid panels. Option B, therapeutic drug monitoring. Option C, paternity and forensic drug testing. Option D, blood cultures for sepsis. The correct answer is option C, paternity and forensic drug testing. Chain of custody is required when the specimen may be used as legal evidence or to establish identity. Forensic drug testing and paternity testing require documentation of collection, handling, transfer, and receipt. Routine clinical tests do not usually require that level of legal tracking. Question 33. What type of vessel links the smallest arteriole pathways with the smallest venule pathways? Option A, capillary. Option B, sinusoid. Option C, lymph duct. Option D, deep artery. The correct answer is option A, capillary. Capillaries connect arterioles and venules and provide the main exchange surface between blood and tissues. Their thin walls allow movement of gases, nutrients, and wastes. Arteries and lymph ducts perform different transport functions. Question 34. Which of the following variables can cause a specimen to appear cloudy or milky white after centrifugation? Option A, high levels of lipids, fats, circulating in the blood. Option B, extensive hemolysis from using a small needle. Option C, elevated levels of direct and indirect bilirubin. Option D, failure to mix an anticoagulant tube after drawing. The correct answer is option A, high levels of lipids, fats, circulating in the blood. High circulating lipid content produces a cloudy or milky serum or plasma appearance after centrifugation. This condition is called lipemia and may interfere with optical laboratory methods. Hemolysis creates red discoloration, while icterus creates yellow discoloration. Question 35. Which of the following tests is typically ordered to detect systemic blood infections or septicemia? Option A, complete blood count, CBC. Option B, blood cultures. Option C, erythrocyte sedimentation rate, ESR. Option D, C-reactive protein, CRP. The correct answer is option B, blood cultures. Blood cultures are ordered to detect microorganisms circulating in the bloodstream. They are essential when septicemia or bloodstream infection is suspected. CBC, ESR, and CRP can support infection assessment but do not identify organisms in blood. Question 36. What constitutes a proper unique identifier sequence for an inpatient according to the Joint Commission? Option A, full name and room number. Option B, full name and date of birth. Option C, attending physician and bed number. Option D, date of birth and diagnosis. The correct answer is option B, full name and date of birth. Two reliable identifiers are required to link the specimen to the intended patient. Full name and date of birth are acceptable because they identify the person rather than the location. Room number, bed number, diagnosis, or physician name can change and should not be used as primary identifiers. Question 37. What is the correct protocol for an inpatient who is sleeping when the phlebotomist arrives to draw blood? Option A, draw the blood quietly without waking them up to minimize pain. Option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. Option C, skip the patient and mark them as unavailable on the computer. Option D, ask the patient's roommate to confirm their identity for you. The correct answer is option B, gently wake the patient, identify them properly, and explain the procedure before proceeding. A sleeping inpatient must be awakened and identified before collection. The phlebotomist should explain the procedure and obtain cooperation when possible. Drawing quietly without waking the patient prevents proper identification and consent. Question 38. Which department of the laboratory processes a comprehensive metabolic panel, CMP? Option A, hematology. Option B, microbiology. Option C, clinical chemistry. Option D, blood bank. The correct answer is option C, clinical chemistry. A comprehensive metabolic panel measures chemistry analytes such as electrolytes, glucose, kidney markers, proteins, and liver-associated enzymes. These tests are processed in clinical chemistry, hematology, microbiology, and blood bank perform different categories of testing. Question 39. Which of the following is a symptom of nerve injury during a venipuncture? Option A dull ache in the antecubital fossa. Option B, a sharp, radiating, electric-like pain down the arm. Option C, a sudden feeling of warmth at the puncture site. Option D, small red spots spreading around the arm. The correct answer is option B, a sharp, radiating, electric-like pain down the arm. Sharp, radiating, electric-like pain suggests contact with or irritation of a nerve. The venipuncture should be stopped immediately to prevent further injury. Dull discomfort, warmth, or petechiae do not signal nerve involvement in the same way. Question 40. What is the correct action if a phlebotomist accidentally sticks themselves with a used needle? Option A, wash the site with soap and water and immediately report the incident to a supervisor. Option B, squeeze the wound to expel blood and apply a tight bandage. Option C, wait until the end of the shift to fill out an incident report. Option D, ask the patient if they have any blood-borne infectious diseases. The correct answer is option A, wash the site with soap and water and immediately report the incident to a supervisor. A needle stick exposure should be washed promptly with soap and water and reported immediately. Rapid reporting allows exposure evaluation, source testing when permitted, and timely post-exposure management. Squeezing the wound, delaying the report, or questioning the patient informally is not an adequate response. Question 41. What type of specimen is used for a guaiac smear test? Option A, sputum. Option B, urine. Option C, feces. Option D, cerebrospinal fluid. The correct answer is option C, feces. A guaiac smear tests feces for occult blood. It is used to screen for hidden gastrointestinal bleeding that may not be visible. Sputum, urine, and cerebrospinal fluid are collected for different diagnostic purposes. Question 42. What occurs when a phlebotomist shakes a blood collection tube vigorously instead of inverting it gently? Option A, hemoconcentration of the plasma. Option B, hemolysis of the red blood cells. Option C, complete inhibition of clotting factors. Option D, falsely elevated platelet counts. The correct answer is option B, hemolysis of the red blood cells. Vigorous shaking mechanically damages red blood cells and can cause hemolysis. Additive tubes should be mixed by gentle inversions so the additive distributes without cell rupture. Shaking does not improve clotting control and can make the specimen unsuitable for testing. Question 43. What color top tube is used to collect specimens for lead testing? Option A, tan or royal blue with EDTA. Option B, light blue. Option C, light green. Option D, yellow. The correct answer is option A, tan or royal blue with EDTA. Lead testing requires tubes certified to be low in trace metal contamination, commonly tan or royal blue with EDTA. Ordinary stoppers and additives can contaminate trace element specimens. Light blue, green, and yellow tubes are selected for different testing needs. Question 44. What type of consent is given when a patient extends their arm and rolls up their sleeve for a blood draw? Option A, informed consent. Option B, expressed consent. Option C, implied consent. Option D, statutory consent. The correct answer is option C, implied consent. Implied consent occurs when a patient cooperates through behavior rather than signing or verbally stating agreement. Extending the arm after the procedure is explained shows permission for a routine blood draw. Written informed consent is used for procedures with greater risk or more formal requirements. Question 45. Which of the following tests measures the average blood glucose concentration over the past 2 to 3 months? Option A, fasting blood sugar, FBS. Option B, oral glucose tolerance test, OGTT. Option C, hemoglobin A1C, HbA1c. Option D, postprandial glucose test. The correct answer is option C, hemoglobin A1C, HbA1c. Hemoglobin A1c reflects the percentage of hemoglobin that has glucose attached over the lifespan of red blood cells. It estimates average blood glucose over roughly 2 to 3 months. Fasting and postprandial glucose tests measure glucose at a specific point in time. Question 46. When using a butterfly winged infusion set with a light blue top tube, why must a discard tube be drawn first? Option A, to clear any residual skin surface contaminants from the needle. Option B, to purge the air out of the butterfly tubing to ensure a proper fill volume. Option C, To activate the coagulation cascade prior to sample collection. Option D. To check if the vein has adequate pressure to fill a full tube. The correct answer is option B. To purge the air out of the butterfly tubing to ensure a proper fill volume. Butterfly tubing contains air that can reduce the fill volume of the first tube collected. A discard tube removes that air so a light blue citrate tube fills to the required level. The discard is not collected to clean the needle or activate clotting. Question 47. What type of transmission is prevented by wearing an N95 respirator when working with a patient who has active tuberculosis? Option A. Droplet transmission. Option B. Contact transmission. Option C. Airborne transmission. Option D. Vector-borne transmission. The correct answer is option C. Airborne transmission. Active tuberculosis is spread by airborne droplet nuclei that can remain suspended in the air. An N95 respirator helps filter inhaled particles when entering an airborne isolation setting. Surgical masks are used for droplet precautions, and gowns or gloves address contact risks rather than airborne inhalation. Question 48. A phlebotomist enters a room to draw blood from an inpatient but notices the patient does not have an identification band attached to their body. What is the proper course of action? Option A. Draw the blood anyway and ask the patient to state their name. Option B. Look for the ID band on the nightstand or 4-pole and scan it. Option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. Option D. Verify identity using the chart at the foot of the bed and complete the draw. The correct answer is option C. Refuse to draw the blood until a nurse attaches a new ID band to the patient. An inpatient must have an identification band attached to the body before routine collection. A band on a table, bed rail, or 4-pole cannot prove the patient's identity. Nursing staff should replace or verify the band before the phlebotomist proceeds. Question 49. Which of the following factors can lead to hemoconcentration during a blood draw? Option A. Releasing the tourniquet as soon as blood flow is established. Option B. Allowing the patient to pump their fist repeatedly and forcefully. Option C. Positioning the patient's arm downward during the procedure. Option D. Using a large bore needle on a deep, patent vein. The correct answer is option B. Allowing the patient to pump their fist repeatedly and forcefully. Forceful or repeated fist pumping during tourniquet application increases local muscle activity and venous stasis. This can concentrate analytes and falsely elevate potassium or other chemistry values. The patient may make a fist, but continuous pumping should be avoided. Question 50. A fasting specimen requires that the patient does not consume food or beverages, except water, for how many hours prior to collection? Option A. 2 to 4 hours. Option B. 4 to 6 hours. Option C. 8 to 12 hours. Option D. 18 to 24 hours. The correct answer is option C. 8 to 12 hours. Many fasting specimens require 8 to 12 hours without food or beverages other than water. This window helps remove recent dietary effects on glucose, lipids, and related analytes. Shorter fasting may not stabilize results, while much longer fasting can create other metabolic changes. Question 51. What is the clinical term for small, red, pinpoint spots that appear on a patient's skin when a tourniquet is applied? Option A. Hematoma. Option B. Hemolysis. Option C. Petechiae. Option D. Ichthyosis. The correct answer is option C. Petechiae. Petechiae are tiny red or purple pinpoint spots caused by small capillary hemorrhages. They may appear when a tourniquet is applied to a patient with fragile capillaries or platelet problems. A hematoma is a larger collection of blood, while ichthyosis refers to broader bruising. Question 52. If a patient feels faint during a draw and has already passed out, what is the best position to place them in once safety measures are met? Option A. Prone position. Option B. High Fowler's position. Option C. Supine with legs elevated or flat. Option D. Standing upright with assistance. The correct answer is option C. Supine with legs elevated or flat. After immediate safety steps, a fainted patient should be placed flat or supine with legs elevated when appropriate. This position helps restore blood flow to the brain and reduces injury risk. Standing or sitting upright can worsen syncope and lead to falls. Question 53. Which of the following is an example of an analytical component of quality assurance? Option A. Double-checking patient identity wristbands. Option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Option C. Delivering critical panic results to a physician on time. Option D. Labeling the collection tubes at the bedside. The correct answer is option B. Ensuring proper maintenance and calibration of automated laboratory equipment. Analytical quality assurance involves the testing process itself, including instrument maintenance, calibration, controls, and reagent performance. These activities ensure measured results are reliable. Patient identification and bedside labeling are pre-analytical steps, while reporting results is post-analytical. Question 54. For which of the following tests must a phlebotomist use a grey top tube containing potassium oxalate? Option A. Erythrocyte sedimentation rate, ESR. Option B. Oral glucose tolerance test, OGTT. Option C. Activated partial thromboplastin time, APTT. Option D. Blood urea nitrogen, BUN. The correct answer is option B. Oral glucose tolerance test, OGTT. Oral glucose tolerance testing uses gray tubes when glucose stability must be preserved over time. Sodium fluoride slows glycolysis, while potassium oxalate helps prevent clotting. Coagulation, chemistry, and hematology tubes do not provide the same glucose preservation. Question 55. Which of the following tests must be kept warm at body temperature during transport to the laboratory? Option A. Cryoglobulins. Option B. Ammonia. Option C. Lactic acid. Option D. Free fatty acids. The correct answer is option A. Cryoglobulins. Cryoglobulin specimens must be maintained at body temperature until processing because the proteins can precipitate when cooled. Warming prevents premature precipitation that can alter test results. Ice transport is used for analytes such as ammonia or lactic acid, not cryoglobulins. Question 56. Which of the following can lead to a rejected specimen due to short draw? Option A. Inverting a lavender tube 8 times. Option B. Thunderfilling a light blue coagulation tube. Option C. Using a 21-gauge needle on a large vein. Option D. Drawing a serum separator tube before a green tube. The correct answer is option B. Underfilling a light blue coagulation tube. A short draw in a light blue tube leaves too much citrate for the amount of blood collected. That imbalance can invalidate patient, INR, APTT, and other coagulation studies. Gentle inversion of a properly filled tube is expected and does not cause rejection. Question 57. What is the clinical name for the thin, white layer of cells that forms between the plasma and red blood cells when an anticoagulated blood sample is centrifuged? Option A. Serum layer. Option B. Buffy coat. Option C. Fibrin web. Option D. Thrombotome. The correct answer is option B. Buffy coat. The buffy coat is the thin whitish layer between plasma and red cells after centrifuging anticoagulated blood. It contains leukocytes and platelets. Serum, fibrin, and clot material are associated with different specimen states. Question 58. Which of the following is an example of an engineering control designed to reduce the risk of needle stick injuries? Option A. Wearing a laboratory coat. Option B. Utilizing self-sheathing safety needles. Option C. Hand washing after every procedure. Option D. Disposing of waste in a biohazard trash bag. The correct answer is option B. Utilizing self-sheathing safety needles. Engineering controls are built-in safety devices that reduce exposure risk by design. Self-sheathing or safety-engineered needles help prevent needle stick injuries after use. Lab coats and hand hygiene are work practice or PPE measures, not engineering controls. Question 59. For which of the following tests must the specimen be protected from light immediately after collection? Option A. Ammonia. Option B. Bilirubin. Option C. Lactic acid. Option D. Prothrombin time. The correct answer is option B. Bilirubin. Bilirubin is light sensitive and can degrade when exposed to room light or sunlight. Protecting the tube promptly helps prevent falsely decreased bilirubin values. Ammonia and lactic acid have temperature requirements, while coagulation testing has fill and timing requirements. Question 60. What is the standard ratio of blood to anticoagulant additive in a light blue coagulation tube? Option F 1:1, Option B 5:1, Option C 9:1, Option D 10:1. The correct answer is option C, 9:1. Light blue coagulation tubes require a 9:1 blood to sodium citrate ratio. This ratio preserves clotting factor measurement without over-anticoagulating the sample. Underfilling the tube changes the ratio and can falsely prolong clotting results. Question 61. Which of the following options defines the proper order of draw for a blood culture, a lavender tube, and a gold SST tube? Option A, blood culture, gold SST, lavender. Option B, gold SST, lavender, blood culture. Option C, lavender, blood culture, gold SST. Option D, blood culture, lavender, gold SST. The correct answer is option A, blood culture, gold SST, lavender. Blood cultures are collected first, followed by serum tubes such as gold SST, and lavender EDTA tubes later. This sequence protects culture sterility and reduces additive carryover. Drawing EDTA before serum can contaminate later specimens with anticoagulant. Question 62. Which of the following elements is critical to include on a manual handwritten specimen tube label? Option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. Option B, patient's insurance policy number and diagnosis code. Option C, phlebotomist's full signature and room number. Option D, name of the ordering physician and laboratory phone number. The correct answer is option A, phlebotomist's initials, patient's full name, DOB, date, and time of collection. A manual tube label must clearly identify the patient, the collector, and the collection timing. Full name, date of birth or other unique identifier, date, time, and phlebotomist initials support traceability. Insurance data, diagnosis codes, and physician phone numbers do not replace specimen identifiers. Question 63. Hemoconcentration can be caused by which of the following actions? Option A, leaving the tourniquet on for longer than 1 minute. Option B, using a needle that is too small for the vein. Option C, inverting the collection tubes too slowly. Option D, puncturing the skin before the alcohol is dry. The correct answer is option A, leaving the tourniquet on for longer than 1 minute. Prolonged tourniquet application traps blood in the limb and allows fluid to shift out of the vessels. This concentrates cells and analytes, producing hemoconcentration and potentially misleading results. Needle size, tube inversion speed, and wet alcohol cause different specimen problems such as hemolysis or contamination. Question 64. Which of the following options defines the proper location for a dermal puncture on an infant's heel? Option A, the posterior curvature of the heel directly over the calcaneus bone. Option B, the medial or lateral margins of the plantar surface of the heel. Option C, the central arch area of the foot pad. Option D, the tips of the smaller toes. The correct answer is option B, the medial or lateral margins of the plantar surface of the heel. Infant heel punctures should be performed on the medial or lateral plantar margins of the heel. These sites reduce the chance of striking the calcaneus and provide suitable capillary blood. The arch, posterior heel, and toes are unsafe for routine newborn heel sticks. Question 65. What should a phlebotomist do if they encounter a patient who does not speak the same language as the healthcare provider? Option A, use hand gestures to explain the invasive procedure and proceed with the draw. Option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Option C, ask the patient's roommate to translate the instructions for you. Option D, cancel the test order and document the patient as uncooperative. The correct answer is option B, enlist the services of a certified medical interpreter to ensure proper communication and consent. Certified medical interpreters ensure that the patient receives accurate information and can provide meaningful consent. Family members or untrained staff may omit, alter, or misunderstand medical details. Clear communication is essential for safety, cooperation, and legal compliance. Question 66. What type of specimen is required for a plasma hemoglobin test? Option A, serum separator tube, SST. Option B, plain red top tube. Option C, heparinized or EDTA plasma free of hemolysis. Option D, whole blood collected in a gray top tube. The correct answer is option C, heparinized or EDTA plasma free of hemolysis. Plasma hemoglobin testing requires plasma that is not contaminated by hemolysis from collection trauma. Heparinized or EDTA plasma is used because anticoagulated blood can be centrifuged to separate plasma. Serum or visibly hemolyzed specimens can falsely affect the measurement. Question 67. If a patient experiences syncope during a venipuncture, what should the phlebotomist do first? Option A, call for an emergency code. Option B, complete the current tube collection. Option C, remove the tourniquet and needle immediately. Option D, place a cold compress on the patient's forehead. The correct answer is option C, remove the tourniquet and needle immediately. Syncope during venipuncture requires immediate protection from further injury. The tourniquet and needle should be removed first so bleeding and needle movement do not continue while the patient loses consciousness. Completing the tube collection is never the priority during a fainting episode. Question 68. Which of the following tubes should be collected last in the standard venipuncture order of draw? Option A, light blue top. Option B, lavender top. Option C, gray top. Option D, green top. The correct answer is option C, gray top. Gray tubes are drawn near the end of the standard venipuncture order because fluoride and oxalate additives can interfere with other tests. Earlier tubes such as cultures, citrate, serum, heparin, and EDTA have higher priority in the sequence. Drawing gray tubes too early increases additive carryover risk. Question 69. Which of the following options describes a pre-analytical error that can occur in phlebotomy? Option A, miscalibrating an automated glucose analyzer machine. Option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Option C, delaying the entry of finalized lab results into the electronic medical record. Option D, misinterpreting a cellular structure under a microscope. The correct answer is option B, misidentifying a patient or mislabeling a specimen collection tube at the bedside. Misidentifying a patient or mislabeling a tube occurs before the sample is analyzed, making it a pre-analytical error. These errors are especially dangerous because the laboratory may produce a technically valid result on the wrong specimen. Analyzer calibration and final reporting occur in later phases. Question 70. What is the function of sodium polyent whole sulfonate, SPS, inside a yellow top blood culture tube? Option A, to inhibit the growth of bacteria. Option B, to preserve glucose levels for bacterial metabolism. Option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. Option D, to lyse red blood cells to release intracellular pathogens. The correct answer is option C, to aid in bacterial recovery by inhibiting complement and phagocytosis. SPS helps blood culture recovery by inhibiting complement, phagocytosis, and some antimicrobial activity in the specimen. This supports survival of microorganisms until incubation and analysis. It is not intended to kill bacteria or preserve glucose for chemistry testing. Question 71. What should a phlebotomist do if they note a discrepancy between the patient's spelling of their last name on their wristband versus the lab order? Option A, correct the spelling on the band using a waterproof marker. Option B, proceed with the draw as long as the first name and birth date match perfectly. Option C, hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. Option D, assume the lab order has a typographical error and proceed with the draw. The correct answer is option C, hold the procedure and contact the nursing staff or registration to correct the identification bands before drawing blood. A spelling mismatch between the wristband and lab order is an identification discrepancy. Collection should be held until nursing staff or registration resolves and documents the accurate identifiers. Drawing first and fixing labels later risks a wrong patient specimen. Question 72. Which of the following is a characteristic of arterial punctures that differentiates them from venipunctures? Option A. The blood is typically dark red or maroon. Option B. The blood will pulse spontaneously into the syringe. Option C. A tourniquet must be applied extremely tight. Option D. The angle of needle insertion is 15 degrees. The correct answer is option B. The blood will pulse spontaneously into the syringe. Arterial blood is under higher pressure and may pulse into the syringe without vacuum assistance. It is usually brighter red because it is more oxygenated. Venous blood typically flows more steadily and is collected at a shallower angle. Question 73. Which of the following parameters must be strictly managed when collecting an arterial blood gas (ABG) sample? Option A. Protecting the syringe from exposure to direct light sources. Option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. Option C. Inverting the syringe 20 times to mix the clot activator. Option D. Using a gray top tube to transport the arterial blood. The correct answer is option B. Ensuring the sample is analyzed within a strict time frame and transported according to facility requirements. ABG specimens are time-sensitive because blood gases and pH can change after collection. The sample must be transported and analyzed promptly according to facility requirements. Delays, air bubbles, or improper temperature handling can distort oxygen, carbon dioxide, and pH values. Question 74. Which additive acts as a glycolytic inhibitor in a gray top tube? Option A. Sodium fluoride. Option B. Lithium heparin. Option C. DDTA. Option D. Thrombin. The correct answer is option A. Sodium fluoride. Sodium fluoride inhibits glycolysis, slowing the breakdown of glucose by blood cells after collection. It is commonly paired with an anticoagulant in gray tubes for glucose-related testing. Heparin, EDTA, and thrombin serve different purposes and do not primarily preserve glucose. Question 75. Which of the following is an example of an implied consent scenario? Option A. A patient signs a formal document for an invasive procedure. Option B. An unconscious emergency room patient requiring urgent diagnostic lab work. Option C. A patient verbally states they agree to the blood test. Option D. A parent signs a waiver for their underage child. The correct answer is option B. An unconscious emergency room patient requiring urgent diagnostic lab work. In an emergency, an unconscious patient may be treated under implied consent when urgent diagnostic information is needed. The law generally recognizes that a reasonable person would consent to necessary care to prevent harm. This differs from a signed consent form or a routine verbal agreement. Question 76. What is the appropriate antiseptic choice for blood culture site preparation in patients older than 2 months? Option A. 70% isopropyl alcohol alone. Option B. Chlorhexidine gluconate or tincture of iodine. Option C. Sterile saline solution. Option D. Benzalkonium chloride. The correct answer is option B. Chlorhexidine gluconate or tincture of iodine. Blood culture site preparation must strongly reduce skin flora to prevent false positive cultures. Chlorhexidine gluconate or tincture of iodine is commonly used for patients older than 2 months, depending on policy. Alcohol alone is not sufficient for many culture protocols, and saline is not an antiseptic. Question 77. Which of the following tests requires a 24-hour urine collection? Option A. Culture and sensitivity, C and S. Option B. Creatinine clearance. Option C. Routine chemical urinalysis. Option D. Pregnancy HCG confirmation. The correct answer is option B. Creatinine clearance. Creatinine clearance testing often requires a 24-hour urine collection to measure renal clearance over time. The timed urine result is usually paired with a blood creatinine level. Routine urinalysis, pregnancy testing, and cultures use different urine collection methods. Question 78. What type of isolation protocol requires healthcare workers to wear a gown, gloves, and use dedicated equipment to prevent spreading resistant GI infections like C. difficile? Option A. Airborne isolation. Option B. Droplet isolation. Option C. Contact isolation. Option D. Protective reverse isolation. The correct answer is option C. Contact isolation. Contact isolation is used for organisms spread by touch or contaminated equipment, including resistant gastrointestinal pathogens such as C. difficile. Gown, gloves, and dedicated equipment reduce environmental spread. Airborne and droplet precautions target respiratory transmission routes. Question 79. What is the main clinical outcome of inadvertent arterial puncture during a venipuncture attempt? Option A. Rapid hematoma formation and bright red pulsing blood. Option B. Falsely decreased systemic blood pressure. Option C. Accelerated hemolysis within the vacuum collection tube. Option D. Immediate collapse of the surrounding capillary beds. The correct answer is option A. Rapid hematoma formation and bright red pulsing blood. Accidental arterial puncture often produces bright red, pulsating blood and can cause rapid hematoma formation. The needle should be removed and firm pressure applied because arterial pressure is higher than venous pressure. Treating it like a routine venous draw increases bleeding risk. Question 80. What should a phlebotomist do immediately after activating the safety device on a used venipuncture needle? Option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. Option B. Drop the needle into a biohazard waste bag with blood-stained gauze. Option C. Set the needle down on the patient's bedside table until the tubes are fully labeled. Option D. Detach the needle from the tube holder adapter and place only the needle into the sharps container. The correct answer is option A. Place the needle assembly into a rigid, leak-proof sharps container located near the point of use. After the safety device is activated, the used needle assembly should go directly into a rigid, leak-proof sharps container near the point of use. Immediate disposal minimizes handling and needle stick risk. Needles should not be recapped, carried around, or placed in regular trash. Question 81. Which of the following blood components is responsible for the initiation of the coagulation process? Option A. Erythrocytes. Option B. Leukocytes. Option C. Thrombocytes. Option D. Hemoglobin. The correct answer is option C. Thrombocytes. Thrombocytes, also called platelets, initiate primary hemostasis by adhering and aggregating at sites of vessel injury. They help form the initial platelet plug before the coagulation cascade stabilizes the clot. Red cells carry gases, and white cells primarily defend against infection. Question 82. What is the liquid portion of an anticoagulated, centrifuged blood specimen called? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Plasma is the liquid portion of anticoagulated blood after centrifugation. It contains clotting factors because clot formation has been prevented. Serum comes from clotted blood and lacks fibrinogen and many clotting factors. Question 83. What is the primary clinical reason for wiping away the first drop of blood during a capillary skin puncture? Option A. To eliminate surface bacterial contamination from the skin. Option B. To remove tissue fluid contamination that can dilute the sample and cause microclots. Option C. To prevent the blood from clotting too quickly in the microcollection tube. Option D. To ensure that the blood flow is adequate for collection. The correct answer is option B. To remove tissue fluid contamination that can dilute the sample and cause microclots. The first drop from a capillary puncture is wiped away because it can contain tissue fluid and activated clotting material. Removing it improves sample concentration and reduces microclot risk. Excessive squeezing after the puncture can reintroduce tissue fluid contamination. Question 84. Which of the following parameters must be strictly managed when collecting a sweat chloride test? Option A. Keeping the sample frozen using dry ice. Option B, preventing evaporation of the sweat sample during collection. Option C, protecting the collecting flask from ambient artificial lights. Option D, drawing a matching light blue tube within 5 minutes. The correct answer is option B, preventing evaporation of the sweat sample during collection. Sweat chloride specimens must be protected from evaporation because chloride concentration can change as water is lost. Proper sealing and timely handling preserve the true concentration. Freezing, light protection, or paired coagulation tubes are not the main handling concern. Question 85. A phlebotomist needs to collect a specimen for a complete blood count, CBC. Which color tube should be selected? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option D, lavender. CBC testing requires anticoagulated whole blood with preserved cellular morphology and accurate cell counts. Lavender tubes contain EDTA, which binds calcium and prevents clotting while maintaining blood cell detail. Serum, citrate, or heparin tubes can alter hematology results or create unsuitable specimens. Question 86. Which of the following situations requires a phlebotomist to follow airborne precaution protocols? Option A, collecting blood from a patient with a suspected MRSA skin infection. Option B, drawing samples from a patient diagnosed with measles or active varicella. Option C, performing venipuncture on a patient with seasonal rhinovirus. Option D, collecting a lipid panel from a patient with hepatitis C. The correct answer is option B, drawing samples from a patient diagnosed with measles or active varicella. Measles and active varicella spread by airborne particles and require airborne precautions. This includes an appropriate respirator and a negative pressure room when available. MRSA skin infections usually require contact precautions, and hepatitis C follows blood-borne standard precautions. Question 87. Which of the following conditions can cause a specimen to be rejected due to hemolysis? Option A, using a needle with a large lumen, such as an 18-gauge needle. Option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Option C, inverting a serum separator tube gently 5 times after collection. Option D, centrifuging a completely clotted serum tube for 10 minutes. The correct answer is option B, drawing blood through an active hematoma or pulling a syringe plunger back too forcefully. Drawing through a hematoma or pulling a syringe plunger too forcefully can rupture red blood cells. Hemolysis releases intracellular contents and may lead to specimen rejection or false chemistry results. Gentle inversion and proper clotting before centrifugation help protect specimen integrity. Question 88. Specimen tubes must be labeled at what point during the collection process? Option A, prior to entering the patient's room. Option B, immediately after drawing the blood, before leaving the patient's side. Option C, at the central processing lab desk. Option D, after the specimen has finished centrifuging. The correct answer is option B, immediately after drawing the blood, before leaving the patient's side. Specimens must be labeled immediately after collection while still at the patient's side. This practice prevents mix-ups between patients, rooms, or batches of tubes. Pre-labeling tubes or labeling later at the desk creates a serious wrong patient risk. Question 89. What is the primary purpose of the multisample needle's rubber sleeve? Option A, to cushion the patient's vein from sudden movements. Option B, to prevent blood from leaking into the tube holder adapter between tube changes. Option C, to keep the needle sharp until it enters the vein. Option D, to guide the needle into the exact center of the vacuum tube. The correct answer is option B, to prevent blood from leaking into the tube holder adapter between tube changes. The rubber sleeve on a multisample needle seals the back end of the needle between tube changes. This prevents blood from leaking into the holder and reduces exposure risk. It does not guide the needle into the vein or protect the vein from movement. Question 90. What is the primary clinical reason for avoiding the basilic vein whenever possible? Option A, it is too small to yield an adequate sample. Option B, it is located near the brachial artery and median nerve. Option C. It has a high tendency to collapse under low pressure. Option D. It contains valves that prevent blood flow into the tube. The correct answer is option B. It is located near the brachial artery and median nerve. The basilic vein lies close to the brachial artery and median nerve on the medial side of the arm. Accidental injury in this area can cause severe bleeding, nerve pain, or other complications. It is used only when safer veins are unavailable and the practitioner is confident in the site. Question 91. What should a phlebotomist do if they note that an inpatient's identification band is attached to the bed rail instead of the patient's body? Option A. Scan the band on the bed rail and proceed with the draw. Option B. Refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. Option C. Ask the patient's visitor to confirm that the band belongs to the patient. Option D. Cross out the name on the band and write it on a new tube label. The correct answer is option B. Refuse to perform the venipuncture until a nurse verifies identity and attaches a new ID band directly onto the patient's body. An ID band attached to the bed rail does not reliably identify the patient. The phlebotomist should not collect until nursing staff verifies identity and attaches a proper band to the patient. Scanning or using a detached band creates a wrong patient risk. Question 92. What is the maximum depth that a lancet should penetrate when performing a heel stick puncture on a newborn infant? Option F 1.0 mm, Option B 2.0 mm, Option C 3.0 mm, Option D 4.0 mm. The correct answer is option B, 2.0 mm. A newborn heel lancet should not penetrate deeper than 2.0 mm. This limit reduces the risk of striking bone and causing osteomyelitis. Deeper punctures are unsafe even if blood flow is difficult. Question 93. What should a phlebotomist do if they notice that the expiration date on a vacuum collection tube has passed? Option A. Use the tube anyway if it is the only one available on the tray. Option B. Discard the expired tube and select a current, unexpired tube from inventory. Option C. Assume the additive inside is still functional for another 6 months. Option D. Write the current date over the expiration date on the label. The correct answer is option B. Discard the expired tube and select a current, unexpired tube from inventory. Expired vacuum tubes may have reduced vacuum, degraded additives, or compromised sterility. They should be discarded and replaced with unexpired tubes from inventory. Using an expired tube can cause short draws, clotting, contamination, or inaccurate results. Question 94. What type of specimen is obtained when a blood sample collected in a heparinized tube is centrifuged? Option A. Serum. Option B. Plasma. Option C. Whole blood. Option D. Fibrin clot. The correct answer is option B. Plasma. Centrifuged blood collected in a heparin tube yields plasma because clotting was prevented. Plasma contains fibrinogen and other clotting factors. Serum requires the blood to clot before centrifugation. Question 95. What represents the correct order for removing personal protective equipment, PPE, after a procedure? Option A. Gown, gloves, mask, goggles. Option B. Gloves, goggles, gown, mask. Option C. Mask, gown, goggles, gloves. Option D. Goggles, mask, gloves, gown. The correct answer is option B. Gloves, goggles, gown, mask. PPE is removed in a sequence that limits contamination of clean skin and clothing. Gloves are usually removed first because they are most contaminated, followed by eye protection, gown, and mask according to facility procedure. Removing the mask too early or touching the outside of contaminated PPE increases exposure risk. Question 96. Which vein is considered the first choice for venipuncture in the antecubital fossa? Option A. Basilic vein. Option B. Cephalic vein. Option C. Median cubital vein. Option D. Brachial vein. The correct answer is option C. Median cubital vein. The median cubital vein is usually preferred because it is large, well anchored, and less likely to roll. It also lies farther from major nerves and arteries than the basilic vein. The cephalic vein can be used when necessary, but it is often less stable and more difficult to access. Question 97. When performing a dermal puncture on an infant's heel, what is the maximum allowable depth to prevent osteomyelitis? Option F 1.0 mm, option B 2.0 mm, option C 3.0 mm, option D 4.0 mm. The correct answer is option B, 2.0 mm. Newborn heel punctures must be shallow enough to avoid the calcaneus and deeper tissues. A maximum depth of 2.0 mm is used to reduce the risk of osteomyelitis and nerve or bone injury. Deeper lancets are unsafe for infants even if they appear to improve blood flow. Question 98. Which of the following parameters can cause a false elevation in a patient's serum bilirubin level? Option A. Exposing the specimen tube to direct room light or sunlight for an hour. Option B. Ensuring the specimen is kept away from light by wrapping it in foil. Option C. Centrifuging the specimen within 30 minutes of collection. Option D. Collecting the sample from a fasting patient. The correct answer is option D. Collecting the sample from a fasting patient. Fasting can increase serum bilirubin in some patients by altering bilirubin metabolism and hepatic handling. Light exposure usually lowers bilirubin by photodegradation, so it would not cause a false elevation. Proper bilirubin handling includes following preparation instructions and protecting the specimen from light. Question 99. Which of the following parameters is most heavily altered if a potassium sample is hemolyzed? Option A. The potassium level will be falsely elevated. Option B. The potassium level will be falsely decreased. Option C. The sodium level will rise to compensate. Option D. The hematocrit level will drop below readable thresholds. The correct answer is option A. The potassium level will be falsely elevated. Hemolysis releases intracellular potassium from red blood cells into the serum or plasma. This produces a falsely elevated potassium result that can appear clinically dangerous. Sodium and hematocrit are not affected in the same direct way by red cell rupture in a chemistry sample. Question 100. A phlebotomist must collect a cold agglutinin sample. How must this specimen be transported to the lab? Option A. Chilled on a slurry of ice and water. Option B. Maintained at body temperature, 37 degrees Celsius. Option C. Protected entirely from light exposure. Option D. Frozen immediately in dry ice. The correct answer is option B. Maintained at body temperature, 37 degrees Celsius. Cold agglutinin specimens must be kept warm because the antibodies can react at lower temperatures and alter the sample. Maintaining body temperature helps preserve the specimen condition needed for accurate testing. Chilling or freezing would encourage the very reaction the test handling is designed to avoid.